Good afternoon and welcome to this special edition of In-Depth School and Community. As you know, we've been running a series of shows featuring various aspects of the virus and its impact on our school system and our community. The last show, as you know, we had the Senate President and Senator Feltus here giving us a more statewide view of how things are happening here in the state of New Hampshire and how the governor's office and others are trying to help combat the spread of the disease. Today we're going to take a little bit different look. I have with us an attorney, Mr. Dean Eggert. He represents a number of districts around the state of New Hampshire as well as many towns. Welcome, Dean.
Thank you, Frank. It's good to be here.
And we're very pleased to have with us remotely Dr. Matthew Gibb. Dr. Gibb is the clinical director of the Concord Hospital, and he will give us a more medical view of what's happening. Thank you, Dr. Gibb.
Great to be here.
So let me start with you, Dr. Gibb, if I could. I know many of our viewers are interested. As we've been reading in the news, there's a surge about to come, and New Hampshire has not experienced that as of yet. So what are your thoughts about the surge that might come our way and how devastating it might be?
Yeah, that's a great question. We're preparing for it. To put some context to it, coronavirus or COVID-19 has a timeline. So if you were to catch it, it may take about 5 days to develop symptoms, and then it may take another 1 to 3 weeks to run its course, which could be mild, moderate symptoms, or for a small percentage, more severe. So the surge is really a phase in the illness where we're seeing community spread. So one person to another in the community, and growing those contacts grows the number of cases.
Right.
So we think in New Hampshire that may play out over the next 3 weeks. If you look at modeling predictions, currently April 24th is felt to potentially be the peak, but this is obviously in flux, and it's really hard to predict exactly.
Right, but one of the questions I think a lot of folks have, and we see this on TV, whether it's national news or local news, social distancing has a mitigating effect on the spread of the disease. So one might think, well, listen, if I really watch what I do and stay far away from other people, will I not reduce the impact of this potential surge you talked about?
Yes, and we think that's probably the most powerful, preventer of the degree of a surge. And the reason is, person-to-person transmission is necessary to propagate the virus. And if you can break that chain in a number of different ways in our communities, you can reduce theoretically the number of cases and the what we would call the peak of the surge. The issue with that is timing. I think we've been ahead of the game in New Hampshire.
Right.
The governor has asked us to do social distancing in many different ways, which we know will be helpful. And we're hoping that because we're later in the game than Massachusetts, we're better prepared to have potentially a lower surge. And for us in healthcare, that means not overwhelming the healthcare system if at all possible.
Right. We'll get back to overwhelming the healthcare system in a minute, but let me turn my attentions to Attorney Eggert. Attorney Eggert, talk to us about what you've seen in your travels, and I'm sure you're doing more remote than actual traveling, but you represent a number of districts and a number of towns. So what have you experienced in the last couple of weeks?
I do, Frank, and one of the most remarkable things that I think I've experienced is, if anything, a newfound appreciation for educators. Mm-hmm. If you think about it, 2.5 weeks ago, the world of education was transformed. Mm-hmm. And literally in the space of 1 week, education was transformed from a bricks and mortar delivery system for public education to remote learning.
Yes.
And so it had a profound impact. I had a hint that things were going to be different when the morning I got up, the first Monday after that executive order, when we were going to remote learning, I saw a school bus on its route, but it wasn't dropping off or delivering students.
No.
It was actually dropping off work for each child for the week.
Right.
What has also amazed me has been the parents.
Yes.
And what has emerged out of this has been a tremendous, maybe newfound collaborative approach to education, where families, parents, children, educators are actually, ironically, even though they're socially distanced, perhaps working more closely together than they ever have before.
Yeah, it's a bold experiment, and we'll talk a little bit about where Concord is at in this, this matrix, and certainly I think folks have all stepped up. But Dr. Gibb, I want to go back to you for a second and talk about, the sense about overwhelming the healthcare system. I know Governor Cuomo's talked about that as well. But the good news, I think, is, and you can speak to this too, even here in Concord, the school system has donated, I don't know how much, but lots and lots of materials to the hospital. And I know there's been many folks who work for us that are also volunteering at the hospital to help out. So could you talk to us about, what your position has been relative to this healthcare system potentially being, overwhelmed?
Yeah, first of all, the response from everyone in the community has been fantastic. We have lots of donations that we're using in all kinds of different ways, and people are donating their time. For us in the healthcare system, we've repurposed the entire healthcare system at Concord Hospital to take care of COVID. And as you know, we've reduced or almost eliminated our routine care or non-critical care. What that means in the hospital is that we have developed negative pressure rooms, which are necessary to treat as an inpatient for people that are acutely ill with this. We've gotten over 80. We started with less than 20.
Wow.
We've repurposed entire floors of the hospital for COVID care. And we're partnering with New Hampshire Guard and the state and other community agencies to put up a surge center, which is at NHTI. And we're this week in the middle of standing that up. And if we got to the point of being truly overwhelmed in the hospital, that would be the area that we would use to treat less ill people and allow the hospital resources to take care of the critically ill folks.
Right. I know one of the things that folks are concerned about, Doctor, and that we talked about this a little bit before the show, is, will the virus come back, year after year, and are there any drugs that have an actual direct impact on the virus?
Yeah, so first part of your question is, will it come back? I think it's likely there will be some seasonality or a second wave to this or more. We hope that as that happens, there'll be other things in our toolbox to help, a vaccine, therapies that we're more certain of if you're ill with the virus. Currently, there are a number of drugs that have been looked at to see if acute phase of the illness could be treated or have a shorter duration or less severe symptoms. And one of those is common in the news, hydroxychloroquine, with another drug, an antibiotic called azithromycin. And that has shown some promise in some small studies from France and China. We have had a couple of patients in the hospital with COVID-19, and we have used this, we think, with some positive effect, although the numbers are really too small anywhere to be absolutely certain. It's going to be good for a large number of people.
Sure. Attorney Eggert, now, obviously your firm's been hit by this too, and you're a big firm. You have, 40, 50 different lawyers who work in your firm on a regular basis. What have you decided to do in terms of workload?
I'll tell you, Frank, the first thing we've done is we've actually had to engage in our own remote learning. If you think about it, nobody wrote the book on how to educate children in a pandemic.
Right.
And nobody really wrote the book on how to operate a firm in a pandemic. And so in some ways, we've had to learn on the fly. And just as our government has moved progressively, just as the medical care system has moved progressively, the business world has had to move progressively. So today, as I sit here talking with you, this meeting is face-to-face in the sense of social distance, 6+ feet.
Right.
But it's probably the only face-to-face meeting I'm going to have this week. And yet, even yesterday, I met with over 30 people. How did I do it? I did it through the remote platforms. In fact, yesterday I had the privilege of training 30 administrators with the Concord School District
Right.
on some of the laws that still come into play
Yeah.
when we educate children, even when we do it remotely.
Right.
In the firm itself, if you were to knock on my front door,
Yeah.
you would run into essential staff only, and that would be measured by our IT person and by our executive director, and that would be about it.
Wow.
Even our administrative assistants are all now taking work digitally, transcribing it digitally, sending it back, and quite frankly, we're probably saving a forest
Well, yeah.
during this time.
That's a good point. I never thought about it that way. Dr. Gibb, are you experiencing a similar kind of situation where you know, you're doing more of your contacts with folks remotely, or are you forced to do a more face-to-face kind of situation?
No, we're standing up what's called telemedicine, which is, you know, a catch term for a number of technologies. But we are, for our routine, you know, care, people that don't absolutely have to come here and be seen, we have pivoted most of our primary care practice work to telemedicine platforms. The technologies we started with are just what we're doing here, which is a phone conversation. And we're working with Zoom to stand up a video-based telemedicine interaction. We've done a couple of thousand visits over the last 2 weeks using one or both of those modalities. The other thing we've done is in the hospital, as I'm sure that law firms do, there's a lot of committee meetings, and we have gotten rid of all those, and what we do have to have, we now do remotely with generally voice conferencing, occasionally video conferencing. So when you come to the hospital, you see the same thing as was described in the law firm, only essential people, and then the folks that have to care for the patients we have in the hospital.
Yeah, speaking of the patients you have to care for in the hospital, so those folks who care for them, are they specially suited? I mean, I saw on TV at some hospitals, they're almost like in a spacesuit. Have you made special precautions for them as well?
Oh, yes. You know, this virus is very contagious, and we are pretty sure it spreads through droplet contamination, person to person, touching your hands and then touching your face. So we have precautions called personal protective equipment, which are basically suits, masks, face masks, and in the design of the rooms, what we call a negative pressure room, these rooms are designed to evacuate the air from the room out of the building and not allow a patient to contaminate or cross-contaminate another area in the hospital. So there's a whole layer of schema in order to try to prevent spread in the hospital.
Wow, that's nice. It gives, I think, our viewers and certainly Dean and I comfort in knowing how the hospital is preparing for, you know, the surge or other people who have to come into the hospital, because, you know, one always fears that this thing's just going to balloon and keep accelerating at an exponential rate. Again, watching the news, you've seen New York, and I think people get very nervous. But from what you're saying, I mean, I'm really pleased to hear this, that, you know, we've taken as much precautionary forethought as we possibly could to ensure that the disease is not in a position where it can transmit itself elsewhere.
Yeah, I think that, you know, we've certainly done everything we know we can do with the resources we have. We're concerned, like others, that we don't know what the size of that surge will look like. We hope it'll not be as high as you're seeing in New York. Right. But what we do, despite all these plans, we still worry about the availability of this equipment over time. If this lasts for months, as you've seen on the national news, the resupply of this type of equipment is still uncertain.
Yeah, I mean, you bring up an interesting point, and that's something we in education are faced with, and I'm sure, Dean, you see it too on your front, and that is, you know, we're okay for, let's say, 2 weeks or a month of remote learning, and I think, you know, teachers and other educational professionals, along with the parents, I think worked really well in trying to find a nice bridge, if you will, between the classroom experience and what we can do through Zoom and through remote learning opportunities. But as the longer this thing goes, the more difficult it's going to be, I fear, down the road. And you also have to worry about the issue of people being, what's it called when you're in the house for too long? Help me out.
Lonely,
Cabin
Frank?
fever.
Yeah, cabin fever. Thank you. Right. And so you get that, but I mean that's I think a fear that a lot of folks have in terms of this disease extending into the summer. Now, is it your position, at least temporarily, things will always change, that we get the surge, let's say, towards the end of April, then I would assume, go on the downward portion of the curve, and so then maybe by Memorial Day we're sort of out of the zone?
I would hope so. You know, when we can only look to other areas to kind of help us predict that.
Yeah.
But once things start improving, there probably is still at least another few weeks to stabilize certainly the health system. And, you know, the real question we all have is, you know, what do we use as a decision to relax social distancing and return to normal, so to speak? And I think, you know, at least in the United States, that's really uncertain right now.
Yeah, you bring up another interesting point, Doctor, and that is, you know, we drive down to Massachusetts. We're primary caretakers for our grandson, and so driving down 93, usually, you know, around, let's say, 5 or 6 o'clock at night is like gridlock. I mean, you got to figure on 2 or 3 hours, and the same holds true if you're going down at 8 or 8:30 in the morning. We drove down the other night, and the road was desolate, and I'm not kidding you, there was hardly anybody on the road.
Yeah, and that's I think a very positive thing right now, because the social distancing is powerful if we actually do it.
Yeah.
And it seems like in New Hampshire and Massachusetts, you know, people are respecting that. You know, and again, it's almost it is a weird feeling to not see a traffic jam down around the border on 93. You know.
True.
So, again, what we use to say we're going to go back to normal, I think that's still a work in progress.
Right, right, for sure. Dean, can you talk to us about, you know, what you've encountered with other districts? Obviously, you're close to Concord because you work with us, and you know what folks have done to try to generate a really good quality remote learning platform. But what are you finding when you go around to other districts?
Well, I had the privilege of sitting in today and listening to a conference call that brought together a lot of directors of student services. It was facilitated by the Department of Education, and the Department of Education has done a really good job bringing together that communication, providing information, being a conduit for the federal government. And so all of the districts are pretty much getting the exact same message. The same message, of course, is to move to remote learning and to support children.
Sure.
Interestingly enough, I think because educators are compassionate people, they're wired to solve problems, probably the most difficult thing on their heart and minds are how they meet the needs of children who are not currently ready to remotely learn.
Right.
And probably, you know, from that Friday where the governor made his announcement,
Yes.
knowing we were going to move to remote learning, the number one question that's been on the minds of every one of these districts is really a concern for the children who might be either marginalized by remote learning
Sure.
or unable to receive all the supports and services they need.
Right.
And so the discussion already, and I have to applaud educators for doing this, by and large, the discussion is not only talking about what are we going to do now, but what might we need to do in the future in order to restore children to what they had and to bring progress, to avoid regression, things like that.
Are you finding, are there changes in the laws, either from the governor's office or from the State Department of Education, in terms of relaxing certain standards to allow educators more room to maneuver, if you will?
There have been a number of standards that have been relaxed and a number that you just simply can't relax because it wouldn't be good educational practice. It might, even if you were to relax that standard, do harm to a child. And so the discussion that I listened to today really focused on the idea that even though standards may be relaxed now, and what are some of those standards? Using web-based platforms that might not meet the local data privacy standard, for example. Having that situation where, if we think about it, all student information is private, and yet certainly there are brothers and sisters walking behind
Right.
that monitor, their
Yeah.
conversations that may be overheard,
Uh-huh.
things that you and I just take for granted as being private in a bricks and mortar setting.
Right.
Those go by the boards, and some of those standards have had to be relaxed.
Mm-hmm.
Even if the law didn't relax them, they would have had to have been relaxed
Sure.
with remote learning.
Right.
And as we move forward, the other thing that unfortunately we've encountered is we had hoped that we would be able to meet the needs of children with the most significant needs through one-to-one support back in the school in small groups.
Exactly. Can't do that now.
Dr. Gibb's circumstances that he's addressing and we're all trying to address have that compelling effect where parents would be reluctant to do that.
Right.
Educators would be concerned. They don't want to be a source point
Exactly.
for providing
Right.
another spread for the coronavirus.
Right.
And so the honest answer is that remote learning, and a positive side to it, by the way, Frank, that some of the districts have brought to my attention,
Yeah.
is that some children were absolutely made to learn remotely.
No question.
Put them in front of a monitor,
Yeah.
and they will learn like there's no tomorrow.
Yeah.
And so there have been some positive stories, and then I just cap off with the idea of relationships.
Uh-huh.
I've seen great relationships develop between professionals working collaboratively to support
Sure.
children, and these are people who, because they were distant already in the building,
Right.
might not have talked as much.
That's true. That's very
Now
true.
they're talking,
Yeah.
even if it's through digital media.
It's changed the landscape, no question about it. But going back to you, Dr. Gibb, so, if you had a message for parents who are now, homebound with their child and they're trying to provide and help out and support this whole remote learning experiment, if you will, some of the fears they have is, okay, I have elderly grandparents with me, I worry about them. Then I have younger children who might be, let's say, 3, 4, or 5 years old, I worry about them. So if you had a message for those folks, what would it be?
So I think there's a couple things to think about. One is the anxiety that a situation like this produces. We all worry. We worry about our bandwidth for
Yep.
care. We worry about, could somebody get sick? I have the same thoughts with my own family. So I think there are, ways to help with the anxiety, and I think one of them is pace your way through it.
Mm-hmm.
You need to know what your resources are. So if it's around health, know what your resources are, education, and think through it a little at a time. We're seeing a lot of folks really become, almost overwhelmed with anxiety of the unknown in this situation.
Sure.
So what we're doing with our staff and our patients are trying to ground them in what we can control and, educate them and provide comfort and, certainly communicate outside of your family units. You can't do that physically because of social distancing, but you certainly can begin to use electronic methods to communicate with each other, to sort of share those thoughts. And, it's not perfect, but we're hoping that, in the next few weeks, we'll have some certainty of where this situation is going to go, and people will, I hope, have less anxiety when we start to see things improve.
Yeah, I mean, that's a great point, Doctor. And I think, just to echo what you said at the beginning and again here now, this whole issue of social distancing, it does work. It does make a difference. And so if all of us can kind of hang in there and follow through on the social distancing motif, then we have a very good chance of, keeping these numbers down, for one, and two, that you as a family member will feel a lot more comfortable that as long as I can, in a sense, mind my P's and Q's and not get involved with other folks, there's a very less likelihood that either myself or a member of my family is going to end up with a disease.
Yeah, that is true. And, I think we all, especially I think in our society, we love freedom and we love getting out and visiting with people. And This is a major change. And what we worry in healthcare is we can maybe get through a few weeks of this and, but that restlessness, cabin fever we talked about, is a real force of nature. And if we're in this for a couple of months, we have to ground people in the necessity to keep at it. So, I think that's the big focus on how to manage the anxiety of the unknown is something we're just bringing above the rug in the health system with our staff in particular. And, no perfect answers, but at least recognizing that, we don't have the end in sight, and we have to keep at this social distancing is an important consideration.
Right, but I mean, by the same token, you don't have to go to the extreme. You don't have to stay in your house the whole time. There's nothing wrong with going outside and going for a walk, as long as you're by yourself or with a member of your family. And so you can still get fresh air, you can still get exercise, you can still go out and do things per se, just as long as you kind of stay true to the social distancing motif.
Yeah, and I think everybody has to pick those things that help them out with, with that cabin fever, and, try to make it a habit to do some of those things every day if possible.
Yeah. Well, thank you. I want to thank you, Doctor, for coming on the show. I really appreciate it, and I'm sure your message will resonate with our folks here in the community in Concord. And Dean, thank you too. I mean, it's nice to know that it's not just education that has to kind of rethink what we have to do. The law profession is doing the same. And I guess the nice message for all three of us here is this, again, everybody stepping forward. Everybody wants to do the best they can to try and alleviate the pressure and the difficulty that we all face. And so that's a really heartening message. And again, I just want to thank our two distinguished guests for coming on the show. I really appreciate it.
Thank you for having me.
Thank you, Frank.
Okay, thank you, and stay tuned for our next show.